Uterine fibroids, it's a condition affecting hundreds of thousands of women, especially African-American women.
Our very own Angela Green is one of those women. She joins us now in the studio with her story.
Well, Ken and Katie, many of the viewers and you all noticed my 6-week absence back in February. That's when I decided, after years of suffering from excruciating pain and literally blood, sweat and tears, to have a major surgery to help ease some of the complications associated with my fibroids. And before I get to my exact story, let's learn exactly what fibroids are and why one local woman reached out to share hers.
So I was at work one day and I had some nausea, vomiting, pain, you know, not really knowing what it was. Went downstairs to the emergency department, found out I had an ovarian cyst and fibroids.
That day, Nurse Kiera Lewis says changed her life. After an ultrasound, doctors found at least 7 fibroids in her uterus, and with them came symptoms that lasted for years, especially during her monthly period.
If you think about it, if you take a week for the cycle, then a week before, it's like half of your life you're dealing with this pain, this situation, this drama.
Kiera is not alone. Up to 80% of women will develop fibroids by age 50. The growths develop from the muscle tissue of the uterus.
What fibroids are, they're very painful to the point to where it hurts just to sit down sometimes and tell you guys the news.
When I shared my story on Facebook, dozens of women, including Kiera, reached out. Fibroids run in her family.
It caught my attention, and by it being something that I can relate to, my mother, my sister, several other women, definitely a lot of African-American women deal with this in my conversations I've had. A lot of people just don't talk about it.
Awareness. It's an issue that my doctor, Marie Rowe with Greenville Women's Clinic, sees all the time.
The most common presentation for a woman with fibroids, they don't come in saying, I have fibroids, what do I do? They come in telling me that they're tired or that their periods are heavy. And a lot of women, they chalk it up to, that's just the way that my body is.
Dr. Rowe says fibroids can be as small as a pea or as large as a watermelon. The symptoms and complications they cause can depend on the number, size, and location of the fibroids, and while they're called tumors, most are non-cancerous.
We don't know why they develop. It can be a genetic predisposition that runs in families. It just happened de novo. We do know that there's a racial disparity with fibroids, that we see more fibroids in African American women, and they tend to grow more aggressively.
Dr. Rowe explains most women with fibroids don't have any symptoms, but at least 30% of those affected will have severe complications.
When fibroids become a problem for a woman, depending on what physical ailments that she has, that can wear on her just like any chronic fatigue syndrome, chronic pain syndrome like fibromyalgia. It wears on our mood and psyche because we know how we feel, yet we don't want to feel that way. But the sense of control is lost until you seek treatment.
There are several treatment options available. Using birth control pills helps to stop the bleeding, but they don't treat the actual fibroids. Then there are surgical options. In fact, fibroids are the leading cause for hysterectomies in women.
Treatment is dependent on your personality. It's dependent on your life stage, whether you desire fertility in terms of future childbearing or not.
Uterine fibroids are also hormone dependent. Hormones make them grow, which becomes a huge issue for women who want children.
It does make me wonder about, are they growing? How would that affect me when it comes time to have children?
Kiera's symptoms are now being managed with birth control pills, and while having children is not a priority, the 31-year-old says her clock is ticking because she recently got married.
My OB/GYN told me when I get ready to have a child to come to them, the surgery may be an option for me. It makes me feel like it's going to be very, very painful. Then there's the higher risk for miscarriage, which is painful on another level. Those are the fears that I have.
Now, that fear is something that's all too real for me and my fiance after we suffered a miscarriage due in part to my fibroids. Coming up tomorrow at 5:30, I'll explain how that actually intensified the growth of my fibroids and take you along on the emotional journey to improve my quality of life.
Each year, hundreds of thousands of women have hysterectomies to treat a condition that's called uterine fibroids.
Over 70% of women will develop them at some point, although fibroids only cause symptoms in about 25% of women. WNCT's Angela Green is one of those women. It's a story that she's opening up about in hopes of helping other women going through the same problem. Angela.
Ken and Katie, the good news is that with the help of technology and awareness, women do have options when it comes to treatment, and completely parting ways with their uterus is not the only option. Back in February, you may have noticed my long absence to have a major surgery after years of treating my complications. It's a story that many of you, our viewers, encouraged me to share. And just a warning, some of the descriptions and images may be disturbing.
This is the cavity of your uterus where, where we have our cycle from, where we get pregnant. And so you can see your fibroids were very much distorting your cavity.
This is video of my actual ultrasound scans that helped doctors diagnose my uterine fibroids. I'm one of the hundreds of thousands of women who suffer from the non-cancerous tumors that can be found throughout the uterine cavity, the muscles, and even outside the uterus. I never had many problems with mine until my fiance and I suffered a miscarriage.
If that pregnancy implants near the fibroid where it's not able to establish a good blood supply, you can have an early pregnancy loss, which is the most common reason for a lot of miscarriages of women that have fibroids.
Dr. Marie Rowe with Greenville Women's Clinic is my OBGYN and performed my surgery. She says the pregnancy set off the growth of the fibroids, eventually leading to even more problems.
Because fibroids grow based off of estrogen, and around pregnancy, that's when our hormones are the highest. And so for you, I think it was the fuel to the fire, if you will. You already had a predisposition with some small fibroids there.
Sit down sometimes and tell you guys the news. It hurts when I'm walking. It makes my belly just bulge out sometimes.
The symptoms left me tired with heavy, constant bleeding and excruciating pain, and most times just an emotional wreck. For years, I tried several different treatment options. None of them worked.
Part of the way you felt was also side effects to putting you on different varying birth controls, because birth control can make you, can cause you to feel hormonal in and of itself, and have unpleasant side effects when it affects your mood. Some people in certain birth controls will feel depressed, and so we were trying to treat your bleeding to help you feel better, but then we were causing other side effects by the hormonal manipulation we were trying to do.
Many of you would take notice during the nightly news, sending me messages asking if I was tired, was I feeling okay, or why was I gaining so much weight? Well, my fibroids made me look as if I were 3 months pregnant, some measuring the size of softballs.
Fibroids basically, they flare and they swell, and then that's where the sense of abdominal bloating comes.
So without the success of drug treatment, I was faced with looking at other options, including having a partial hysterectomy.
For the record, I'm under 40, so having a hysterectomy, for me, all types of things went through my head.
When you go to make a decision about surgery on your uterus, and definitely, before you're ready to part ways with your uterus, it's a major decision. And patients will hear me say, I want you to be 150% sure, of your fertility options.
Then the day came for my surgery, a myomectomy, to remove my fibroids, but kept my uterus intact so I can have children in the future.
So for you, you had a major, what we call exploratory laparotomy, where you have an incision that's very much similar to someone that's had a C-section.
These are the 13 fibroids that Dr. Rowe removed from various parts of my uterus, more tumors than the ultrasound was able to detect.
I thought before going into your surgery that you had, about 3 major fibroids that were the problem. And once we got in and saw exactly how many you had, I was very, surprised as well.
The surgery took about 3 hours, then 3 nights and 2 days in the hospital, and then 6 weeks of recovery at home.
You feel every sense because your muscles, your nerves, everything was separated in order to complete your surgery, with taking those fibroids out.
So for now, my uterus is fine.
Your uterus is fine, yes.
All right, Angela, how long has it been since that surgery?
It's been exactly 3 months.
Wow.
A little bit. So.
Now, Angela, you had the surgery, but are your fibroids completely gone?
Yes and no. They're gone. The surgery was to actually remove them, cut them out. But the fibroids can grow back. They're all hormonal, so at any point they can flare back up and come back. I chose that surgery again because I do want to have children eventually one day. So opting to have a hysterectomy would have completely taken out my uterus. That would have solved the problem. Just emotionally, mentally, I don't think I was ready to have a hysterectomy.
It would trigger other problems other than just not being able to have babies.
Yeah, and that's a myth. Back and forth. That's something that me and my doctor
went back and forth about, because there are so many myths out there about hysterectomy, and it would have been a partial hysterectomy, so you still would have your fallopian tubes, and for women that's very important when it comes down to your hormones. So still would have gone through PMS and everything else that women have to deal with. So it's a lot to understand, and for men, you have to understand. I know it's uncomfortable for you, Ken.
Right?
Yeah, it's very uncomfortable for men to talk about, but just be supportive and understand that us women go through a lot.